You're looking to understand something important without getting totally lost in the weeds, right?
Yeah, that's the goal.
That's what we try to do here. Today, we're diving into, well, a really fascinating topic. It might surprise you, actually. Its connection to a well-known human health issue,
Hmm.
feline immunodeficiency virus, or FIV.
That's right. We've looked through the research, sort of pulled out the essentials on this retrovirus in cats.
Okay.
And that term retrovirus, well, it might ring a bell because FIV is actually in the same viral family as HIV.
Wow, right?
Yeah, the virus causing AIDS in humans, they share, fundamental mechanisms, which makes feline FIV quite a variable model for understanding human retroviral diseases too.
Okay, hold on. A virus in cats related to HIV that is surprising. So our goal today, our mission for this deep dive, is pretty straightforward then.
Yeah, I think so.
To get the core of FIV, what it is, how it impacts cats based on the key findings.
Exactly. Let's start with the basics. FIV, it's a complex retrovirus.
Yeah.
And like we said, it's a lentivirus.
Right.
Same genus as HIV. But it's really vital to remember, while they're related, they're distinct viruses. They affect different species. You can't get HIV from a cat or FIV from a human.
Got it. Same family, different targets. Very clear. So how does FIV actually affect a cat's health? What does it do?
Well, the way FIV works is complex. But basically, it messes with the cat's immune system in several ways, actually.
Right.
Think of the immune system like an army, right? Protecting the body. FIV just throws that army into disarray.
Chaos.
Kind of, yeah. It causes different immune cells to malfunction. We see changes in the communication signals between cells, sort of an overall hyperactivity of some immune cells.
So they're working overtime, but maybe not effectively.
Exactly. And then a state where the immune system becomes unresponsive, called anergy, and even the death of really important infection-fighting cells, apoptosis.
Okay, that sounds bad.
It is. And what's also interesting is that different strains of FIV, like subtypes A and B, which are common here in the U.S., they can have slightly different effects on the cat.
So the impact isn't always the same. It depends on the specific virus strain.
Precisely. The infection usually kicks off when the virus gets in, typically through a bite wound.
Ah, okay.
Then it travels to key immune system areas, lymph nodes, the thymus gland. This journey is often helped along by specific cells called dendritic cells.
Right.
The virus initially goes after T lymphocytes, specific immune cells, and then later it infects another type called macrophages.
Okay, so it's like a targeted attack on the immune system's command and control centers.
That's a good way to put it. The virus uses specific doorways on these cells to get inside. Receptors. The main doorway for FIV is called feline CD134, and it uses another one, CXCR4, as a co-receptor, kind of like needing two keys.
Okay.
Now, while both CD4 plus and CD8 plus cells can be infected in the lab, in a living cat, FIV primarily and progressively, reduces the number of CD4 plus T cells.
And those are the really important ones.
They're crucial. They coordinate the immune response, the generals, like you said.
So why is that drop in CD4 plus cells so significant?
Because, well, they're essential for organizing the body's defense against infections. So fewer CD4 plus cells means the whole immune system is weaker.
Makes sense.
Over several months, this decline leads to a flip in the ratio of CD4 plus to CD8 plus cells. Normally, it's about 2 to 1, CD4 plus to CD8 plus L.
Okay.
With FIV, this ratio can drop below 1 to 1. And eventually, there's just an absolute decrease in the total number of CD4 plus T cells. This imbalance really shows how weakened the immune command center has become.
That sounds very similar to what happens in human HIV infection.
The parallels are definitely there, yeah. It's one reason studying FIV is so useful.
Right.
What's also intriguing is that early on in FIV infection, the body activates a type of CD4 plus cell called a regulatory T cell.
Okay, regulatory. So they try to control the immune response.
Exactly. But scientists think this early activation might actually hinder the cat's ability to fight off FIV effectively, almost like it damps down the useful response too early.
So the body's attempt to regulate might actually be counterproductive here.
Interesting. That's one possibility being explored. Clinically, cats often don't show any outward signs of illness in these early stages. It's often asymptomatic for a while.
Sneaky.
Very. Symptoms typically show up later when their cell-mediated immunity starts to weaken. That's the part crucial for fighting viruses inside cells.
Right.
This weakening is linked to fewer signaling molecules called Th1 cytokines. And later still, even the antibody response, the humoral immunity, becomes less effective.
So both major branches of the immune system eventually take a hit.
Exactly. The defenses are attacked on multiple fronts. And it's key to remember that macrophages, they become the main long-term hiding place, the reservoir for the virus.
So they're not just infected, they're hiding it.
Yes, and they carry it around the body, they transport it everywhere, causing various problems, including more production of a molecule called
TNF?
tumor necrosis factor.
Yeah.
It promotes inflammation. This ramped up inflammation is likely why we see things like fever and weight loss, that wasting in later stages.
Macrophages, normally the protectors, now turned into carriers and inflammation drivers.
Precisely. And besides immune cells, FIV can potentially infect other cells too, like astrocytes and microglia in the brain.
Brain cells.
Yeah, which might contribute to nerve cell damage. It might also infect megakaryocytes involved in blood clotting and some bone marrow cells.
Wow.
And here's another layer. If a cat also has feline leukemia virus, FLE.
Oh, another common feline virus.
Right. That co-infection can actually increase the amount of FIV found in organs like the kidneys, brain, and liver, potentially making the effects of FIV even worse.
That sounds like a really dangerous double whammy.
It can certainly complicate things significantly.
Okay, so we've covered the microscopic world, how FIV attacks the cells. Let's zoom out. How does this manifest in the cat's overall health? What kinds of problems does FIV actually cause?
Well, because the immune system is so central, FIV can affect many, many parts of the body. For instance, in the digestive system, it can sometimes cause issues that look a bit like panleukopenia, which is a really serious disease itself.
That's definitely a concern. What about other systems?
In the blood, lymph nodes, the immune system generally. We see that drop in CD4 plus T cells we talked about. But also, you can get accumulations of immune cells, these lymphocytic, plasmacytic infiltrates, in tissues, especially the gums and lymph nodes.
Okay.
And unfortunately, FIV also increases the risk of certain cancers, particularly lymphomas and mast cell tumors.
So it's not just about being more prone to everyday infections, it's cancer risk too.
Not at all. The nervous system, FIV, can affect those brain cells, neurotransmitter balance, potentially leading to neurological signs.
Like what kind of signs?
We'll get into specifics later, but behavioral changes, movement issues. In the eyes, it can cause inflammation in the front part, anterior uveitis.
Okay.
Kidney problems, nephropathy, that's another potential issue. And reproduction. FIV can contribute to fetal death or infections around the time of birth.
That's quite a range of potential complications. It seems like it touches almost everything.
And layered on top of all that, the major consequence is just increased vulnerability to secondary infections. With that weakened immune system, cats are just sitting ducks for other bacteria, viruses, fungi.
Makes sense. Are some cats, like, genetically more likely to get FIV?
You know, interestingly, no. There doesn't seem to be a direct genetic predisposition to getting infected.
Oh, okay.
But a cat's genetics might influence how the disease progresses, how severe it becomes for that individual cat.
Right. Like with many diseases, the individual response varies. What about how common it is? How widespread is FIV?
In the U.S. and Canada, studies suggest maybe 1.5 to 3% of generally healthy cats might have it.
Okay, that doesn't sound huge.
No, but that number jumps significantly if you look at cats that are already sick for some reason.
Yeah.
Then it's more like 9 to 15%.
Ah, okay. So it's much more common in unwell cats.
Exactly. And it's found worldwide, but the rates vary quite a bit by region.
And are certain types of cats more likely to get diagnosed? Age. Sex.
Yes, definitely. Species, obviously. Domestic cats.
Yeah.
Age. The average age at diagnosis is around 5 years old.
Midlife, kind of.
Yeah. And importantly, the prevalence, the likelihood of being infected actually increases as cats get older.
Oh, interesting. So it's not just a young cat disease.
Not at all. That might challenge some assumptions.
Mm.
And sex. It's notably more common in male cats.
Okay. Why the difference between males and females?
It really comes down to behavior, mostly. Male cats, especially unneutered ones, tend to be more territorial, roam more.
Get into the fights more.
Exactly. More fights mean more chances for bite wounds, and bite wounds are the main way FIV spreads.
Ah, okay. So it's more about lifestyle risk from fighting than biology in that case. So what are the actual signs an owner might see? What should they look out for?
The signs can be really varied. That's what makes diagnosis tricky sometimes. Because FIV weakens the immune system, the illnesses that pop up are diverse. And unfortunately, they can look a lot like illnesses caused by other things, including FLV, that other retrovirus.
That must be challenging for vets trying to figure it out.
It can be. Often, what owners might report is a history of, recurrent minor illnesses. Things keep cropping up,
Like what?
especially problems with the upper respiratory system, sneezing, runny nose, that sort of thing. And the digestive system, maybe occasional vomiting or diarrhea that keeps coming back.
So it's often a pattern of these recurring, maybe less severe issues rather than one big crisis initially.
Often, yes.
Yeah.
Especially early on. Now, on a physical exam, what a vet finds really depends on what secondary problems have developed at that point.
Makes sense.
But a common finding is mild to moderate enlargement of the lymph nodes. You might feel them being a bit bigger.
Okay.
And significant dental problems. This is a big one. Gingivitis, stomatitis, inflamed gums, inflamed mouth periodontal disease. These are really common, affecting maybe 25 to 50% of FIV positive cats.
Wow. So really bad teeth and gums could be a major clue then.
It can be a strong indicator.
Yeah.
Definitely worth checking for FIV if you see severe, persistent oral inflammation.
Good to know. What else?
Upper respiratory issues like rhinitis, conjunctivitis, keratitis, inflammation in the nose, eyes, cornea, seen in maybe 30% of cases.
Okay.
And these are often linked to co-infections with common cat viruses like herpes virus and calicivirus, which can flare up more easily.
Right. The weakened immunity lets them take hold.
Exactly. Chronic kidney problems, often that immune-mediated type affecting the kidney filters. Persistent diarrhea, maybe in 10–20% of cats. Could be due to bacteria, fungi, parasites, or even FIV directly affecting the gut.
It really sounds like FIV just opens the door for all sorts of other problems.
That's a perfect way to put it. We also see chronic or recurring ear and skin infections, bacterial or fungal, later stages, fever, weight loss, that wasting syndrome, possibly due to those high TNF levels.
Right, the inflammation.
Eye problems beyond just conjunctivitis like uveitis, inflammation inside the eye, maybe glaucoma. And sadly, that increased risk of lymphoma or other cancers is always a concern.
Any neurological signs again?
Yes, sometimes. Disrupted sleep, weird behavioral changes like pacing or sudden aggression, maybe cognitive issues, motor problems, even peripheral nerve issues. The list is pretty broad.
Okay, so given this huge range of nonspecific signs, how do vets actually confirm it's FIV?
Right, it's a process. Diagnosis involves putting together the cat signs, their history, risk factors like being male and outdoors, and then using specific diagnostic tests. A crucial first step is ruling out other things that cause similar signs.
Like what?
Other primary infections, bacterial, parasitic, viral, fungal. Toxoplasmosis is a big one to rule out, especially with neurological or eye signs. And of course, non-viral cancers. So it's partly elimination, partly specific testing.
What about routine blood work, like a CBC or chemistry panel? Does that help?
It can give clues, but it's often not definitive for FIV itself. Blood counts might be normal sometimes. Or you might see anemia, low white cells like lymphocytes or neutrophils, or even high neutrophils if there's a secondary bacterial infection fighting going on. Blood chemistry might show high protein, specifically high globulins, because the body's making lots of antibodies.
Hypergammaglobulinemia.
Exactly. But the key is the specific FIV tests.
Right, the ones that actually look for FIV itself or the response to it.
Precisely. Serologic testing looking for antibodies the cat made against FIV is the most common way.
Okay.
The ELISA test is the standard screening test. You can get in-house kits or labs run it.
Easy to do then.
Relatively. But it's really, really important to know. A positive ELISA result needs confirmation, especially in a healthy cat that seems low risk, or definitely before making a major decision like euthanasia.
Why? False positives.
Yes, false positives can happen, though the tests are generally good. Confirmation uses a more specific test, usually the Western blot or immunoblot. That confirms the antibodies are really specific to FIV.
Okay, so screen with ELISA, confirm with Western blot. Got it.
And there's a huge point for kittens under 6 months old.
Ah, yes, you mentioned this briefly.
They can test positive in these antibody tests even if they aren't infected.
How?
Maternal antibodies. If the mother cat had FIV, she can pass antibodies, not the virus itself usually, but the antibodies to her kittens through the placenta or milk.
So the test picks up mom's antibodies, not the kitten's infection.
Exactly. So a positive test in a very young kitten needs a retest later, usually recommended around 8 to 12 months of age, to see if they are still positive after maternal antibodies would have faded.
That's really critical information for shelters and new kitten owner.
Absolutely crucial.
What about vaccinated cats? You touched on this too. What happens with tests then?
This is the other major testing complication. Cats that have received the FIV vaccine will test positive on antibody tests, like ELISA and Western blot, period.
Because the vaccine makes them produce antibodies.
Exactly. The vaccine does its job, stimulates antibody production. But then the standard tests can't tell the difference between antibodies from vaccination and antibodies from a real infection.
That sounds like a massive headache for diagnosis.
It is. It's a significant challenge.
So how do you tell if a vaccinated cat is actually infected?
It's tough. Other methods exist, like trying to detect the virus itself using virus isolation or RT-PCR.
PCR tests.
Yeah, but they're often considered experimental, or results can be inconsistent between labs. PCR can be useful sometimes, maybe in those vaccinated cats or kittens with maternal antibodies, but it's not a perfect solution for telling vaccination apart from infection reliably.
So antibody tests are confusing in vaccinated cats, and PCR isn't totally reliable. Yikes.
It's a tricky area. Sometimes looking at that CD4 plus, CD8 plus ratio can give a hint about immune status in a positive cat, but again, it doesn't definitively distinguish vaccine from infection.
Okay. What if a vet does, say, a lymph node biopsy or, unfortunately, a necropsy after a cat passes? What might they see under the microscope?
Pathologic findings can be suggestive too. In the lymph nodes, initially you might see hyperplasia, lots of activity, plasma cell infiltration. Later, it might become depleted, sort of brunned out. Terminal stages often show significant lymphoid depletion. You can also see those accumulations of lymphocytes and plasma cells in lots of tissues: gums, spleen, kidney, liver, brain.
Okay.
In the brain, specifically, maybe inflammation around blood vessels, perivascular cuffing, gliosis or scarring, neuronal loss, white matter changes, occasionally giant cells. And in the gut, sometimes lesions that look similar to feline panleukopenia. So yeah, microscopic changes add to the picture.
Okay, so a cat has gone through the tests, maybe multiple tests, and gets diagnosed with FIV. What does life look like now for that cat and their owner?
The main focus really shifts to management, primarily managing any secondary or opportunistic infections that crop up because of the weakened immune system.
Right. Treat the consequences.
Exactly. For most 5E positive cats, especially those feeling well, regular outpatient care is usually fine. They might need hospitalization if they get a really severe secondary infection that needs intensive care for a bit.
Okay. What about their day-to-day life? Do they need special housing, restricted activity?
Generally, no. Their activity level can usually stay normal. Strict isolation within a home isn't typically necessary unless maybe they have a contagious secondary infection you need to contain.
Right.
Diet can usually be normal too, unless they develop something specific like kidney disease or chronic diarrhea that needs a therapeutic diet.
Okay.
Client education here is just massive. Owners need to understand, FIV is usually slowly progressive. Many antibody-positive cats that seem healthy can stay that way for years.
That's the hopeful part.
It is. But owners of cats that are showing clinical signs need to be prepared for recurring or chronic health issues that will need ongoing vet care.
Got it.
And we strongly, strongly recommend keeping FIV-positive cats strictly indoors.
Why is that so important?
Two main reasons. One, it protects them from picking up other infections or parasites their immune system might struggle with. Two, it prevents them from potentially spreading FIV to other cats through fighting and bites.
Makes perfect sense. Protect the infected cat, protect the cat population outside. Are there specific medical treatments for FIV itself, like antivirals?
There's no cure, unfortunately, no way to completely eliminate the virus. But there are some medications that can help manage it. Pidavudine AZT, also known as Retrovir, that's an antiviral drug. It seems most effective during the acute early stage of infection. But you have to monitor carefully for side effects, especially bone marrow toxicity.
So it has risks.
It can, yes. There are also various immunomodulatory drugs, things like interferon or Propionibacterium acnes preparations, aceman. These might help with some clinical signs, maybe improve survival in some cats. Different drugs, different protocols.
Do they help with the mouth issues?
Sometimes. But honestly, the gingivitis and stomatitis can be really, really tough to manage effectively, even with these drugs. It often requires a multi-pronged approach, including excellent dental care.
So managing those dental problems is often an ongoing battle.
It frequently is, yeah.
What about other medications for the secondary stuff?
Absolutely essential. Antibiotics, antifungals are often needed for those secondary infections. Sometimes you need longer courses or maybe higher doses than usual because the immune system isn't helping as much.
Right.
Specific drugs like metronidazole or clindamycin are good for anaerobic bacteria, common in mouth infections. For immune-mediated inflammation, sometimes careful use of corticosteroids or even gold salts might be considered.
Corticosteroids, aren't they immunosuppressive too?
They are. which is why it's careful use. You have to weigh the benefit for inflammation against the risk of worsening immunosuppression. It's a balancing act. Yeah. For cats not eating well, short-term appetite stimulants might help. For eye inflammation, topical steroids might be used, though sometimes the response isn't complete. Pars planitis, another eye issue, sometimes resolves on its own.
Yeah.
And standard glaucoma treatments if that develops.
What about routine vaccinations for FIV cats?
Good question. Yearly vaccination using inactivated or killed vaccines for common respiratory and gut viruses like FERCP and maybe rabies, depending on laws, is generally recommended. The idea is to maintain protection against other common threats.
But inactivated vaccines specifically?
Yes, that's the key distinction.
Are there any medications or vaccines that should absolutely be avoided?
Yes. Griseofulvin, an antifungal, should generally be avoided or used with extreme caution. It carries a risk of severe neutropenia, dangerously low white blood cells in FIV cats.
Okay, good to know.
And generally, we avoid modified live virus MLV vaccines. There's a theoretical small risk they could actually cause disease in an immunosuppressed cat.
Stick to killed vaccines.
That's the safer approach, yes. And as we mentioned, use systemic corticosteroids cautiously due to their immunosuppressive effects.
Okay, so how often does an FIV-positive cat need checkups?
It really depends on the individual cat. If they're stable and asymptomatic, maybe twice-yearly checkups are good. If they have active secondary infections or chronic issues like kidney disease or stomatitis, they'll need much more frequent monitoring tailored to those problems.
Makes sense. And prevention, we talked about bite wounds.
Yeah.
What are the key ways to prevent FIV?
The absolute #1 thing is preventing contact with FIV-positive cats, which mostly means preventing bites.
So keeping cats indoors.
Keeping cats indoors is hugely protective against FIV, yes. And neutering males can reduce roaming and fighting tendencies.
Good points. What about multi-cat households?
Crucial to quarantine and test any new cat before introducing them. Note their FIV status first. If you have a stable household where cats don't fight, an FIV-positive cat can sometimes live with FIV-negative cats with very low risk of transmission, but it requires careful management and depends on the cat's personalities. But testing first is key.
Okay. And the vaccine. You mentioned the issues, the varied efficacy, the testing problem. Is it still something owners should consider?
It's a really difficult decision. There is a vaccine available. It's a dual subtype, inactivated type. Studies on how well it works have shown really variable results, anywhere from 0 protection to quite high protection.
So not guaranteed.
Not at all. And the huge downside, as we discussed, is that vaccinated cats will test positive on antibody tests, making it impossible to tell vaccine antibodies from infection antibodies using standard tests. And PCR isn't a reliable workaround.
Right.
So owners and shelters have to weigh that potential variable protection against the permanent inability to easily interpret future FIV tests. Many vets have different opinions on whether the pros outweigh the cons.
That's a really tough trade-off for owners. Okay, so looking at the big picture, what's the overall outlook? The long-term prognosis for a cat diagnosed with FIV?
It's actually quite a bit more encouraging than many people might think, or than the name feline AIDS might imply.
Oh, good.
Within the first 2 years after diagnosis, which might be, say, 4.5 to 6 years after they actually got infected, maybe about 20% of cats die from FIV-related causes. But that means over 50% remain asymptomatic during that same period.
So a majority are still doing okay years after infection?
Yes, absolutely. It's usually slowly progressive. Now, in the very late stages when you see that wasting syndrome, frequent severe opportunistic infections, maybe cancers, then yes, the life expectancy is often less than a year.
Okay.
But overall, many FIV-positive cats, especially with good veterinary care, prompt treatment of secondary issues, kept indoors. They can live for many years, often close to a normal lifespan, with a good quality of life, very similar to uninfected cats.
That is really important to emphasize. An FIV diagnosis is not necessarily or even usually an immediate death sentence. Many cats can live well for a long time.
Precisely. Good management makes a huge difference.
Absolutely. It sounds like it's really about understanding the virus, managing those downstream effects proactively, and, crucially, preventing further complications or spread.
Yeah.
So, to kind of wrap up our deep dive today on FIV, it's this retrovirus in cats. Fascinatingly related to HIV, but definitely cat-specific. It weakens the immune system over time, making cats susceptible to other illnesses. Diagnosis relies mainly on antibody tests, but we have those big caveats about kittens and vaccinated cats. powerful message. With proper care managing secondary infections, good nutrition, keeping them safe indoors, many FIV-positive cats can live long, happy, healthy lives. And that connection to HIV just underscores how studying these viruses across species is so valuable.
It really does. Understanding retroviruses in one species, like cats, genuinely gives us insights that can help with human health and vice versa.
Which brings up maybe a final point for you, our listener, to think about. Given these similarities, but also the key differences between FIV in cats and HIV in humans, what broader lessons can we learn about how these retroviruses work? And maybe how should we approach the ethics and practicalities of testing and managing these kinds of infections in different species?
Yeah, definitely some food for thought there about comparative medicine and virology.
For sure. Thanks for joining us for this deep dive into feline immunodeficiency virus.